Denise Koch.
And I'm Rick Ritter. Again, welcome to those of you watching on CBS News Baltimore and right here on WJZ TV. Well, the other big story we're following this afternoon, monkeypox causing a lot of concern now across Maryland and the country, really, as those cases continue to rise. Some states now declaring a state of emergency.
And there is a limited supply of vaccines. Here in Maryland, state leaders announcing a plan to distribute the limited doses.
And WJZ live at 4 o'clock tonight. Joy Burnett has some details on how the state is trying to control the disease. Joy.
Hello, Rick and Denise. Well, 3 states have already declared a state of emergency. Maryland is not one of them, but you mentioned the limited supply. Because of that issue, officials here in Maryland are limiting who can get the 2-dose vaccine at this moment.
Monkeypox continues to infect more people in the U.S. The CDC says nationally, the caseload is doubling every week, with about 6,300 cases in the U.S. so far. And in Maryland, 149 people have tested positive as of today. Dr. Amesh Adalja with Johns Hopkins talks about the limited vaccine supply.
The biggest challenge right now is getting vaccine into the arms of high-risk individuals because we know this vaccine is safe, it's effective, we just don't have enough of it.
Maryland health officials say the state has received doses for only about 3,200 people. And because of that, vaccines will be limited to close contacts of those who tested positive, including someone you live with, and people who may be exposed to the virus because of their job. Right now, the virus is mostly affecting men who have sex with men. Brian Thomas, a travel nurse from Baltimore, said he got the virus after attending a pride parade in Florida. His first symptom was a rash.
I was tested positive, and then the lesions kind of developed for me over about 5 to 7 days. So like every day I woke up with a few new pox.
The CDC says the virus spreads through close contact, including skin to skin, or in cases where someone touches a rash, scabs, or body fluids, or even objects like towels of a person who has the virus. Monkeypox can be very painful because of symptoms like lesions that develop on the skin. Dr. Adalja says the virus does not spread as easily as COVID-19.
You cannot just say COVID-19 is a virus, monkeypox is a virus, therefore they will act the same. Each virus has its own transmission characteristics, its own countermeasures, its own contagiousness, so you can't equate the two.
And testing is still very limited. There's no at-home testing at this point. If you need to get tested, you will have to call your doctor. And tomorrow, Baltimore City will be having a clinic, but they still have a very limited criteria for who can actually get those 2-dose vaccines. Go to our website for additional details. I've also just tweeted those details for you. Live at 4, Joy Burnett for WJZ.